And first we have today is Paul Moulton from Isle of Man Television. Good afternoon, Paul. Faster Mai.
Good afternoon, Chief Minister. Clearly, I think from what you're saying there, that this one person in the school that has been found positive, although showing no symptoms, only has come to light because they had a test for some other reason, which immediately puts everyone now on much more of a higher warning, do they not? That there should be more testing going on. You said from the very beginning, test, test, test. This would not have been caught, would it, this early, if that person hadn't gone for a test for some other reason?
Henrietta, would you like to take that?
That is true, yes.
Are you not worried that that could have been weeks before you could have done the tracing back to find that one person who in a school, forget the children being infected, it's them all going home to their parents. This could be what would be deemed a super spreader. It's been caught luckily quite early.
No, there is no reason whatsoever, and I must stress that, to believe that this particular case is a super spreader, or indeed that any particular case is a super spreader. And it's really important not to make statements like that, I think.
Because?
The sensitivities that potentially go around that.
Why?
Where I think you might have been trying to go with this, although we have been through this multiple times, around the issue of continuous ongoing population testing, because clearly there would not have been any particular reason to go in and offer testing to a particular school or a particular anything else. So should we have been doing widespread mass population testing? As I say, we've been through multiple times in these sessions why that is not indicated, why the evidence for that, even in high prevalence areas, such as Liverpool being a very prime example, is not there. And that actually, if you offer mass testing, you will only get a snapshot. It doesn't show whether that person is actually infected. It just shows whether they're shedding at the time that you did the test. And you then have all the issues around who comes forward for mass testing. They are generally not representative of the entire population. There will be certain people who present for that kind of thing, and others who, for whatever reason, actually try and avoid that kind of mass offer, even though they may actually be at more risk than the people that do come forward. Overwhelmingly, this is a virus that passes from person-to-person contact. So the way to control it is to avoid as many interpersonal contacts as you can. And you can do that without the need for a test. Indeed, a test can actually cause problems with that because it can give false reassurance. If your test is negative, you may falsely interpret that to mean you are at no risk to yourself or anybody else, and you can do what you like and perhaps be a little bit more interactive with others than you might have been otherwise. And of course, just being told you have a positive test result, again, doesn't necessarily change behaviour. And that's certainly been an issue that's been experienced across, where there are concerns about the response of people who've actually been contacted through the track and trace system and asked to self-isolate, and the evidence that in some circumstances actually only a very small proportion of the people advised to do that actually do it.
Okay, well,
Thank you. Your next question, Paul, please.
I haven't finished. I need to go back on this one. Sorry.
No, I have finished. Your next question, please.
You stopped me asking a forwarding question on this very important day. Seriously.
You asked it exactly the same question yesterday.
No, not at all, because super spreading is just a terminology that we're using in the general public. A school child for 2 days has had the chance to spread that amongst all the other children. That's what I mean by super spreading. Don't take the, I don't know the exact word you want to use, but that is quite serious, is it not?
Well, I think you've had a rather lengthy answer from the Director of Public Health on that topic. So do you want to move on to your next question?
Okay. You said you've had this one result back which has got the UK variant in it, the new one. But that goes back some time. We're still down to this point of finding out what's in the community right now. Is this not the moment now to talk to Rachel Glover, make up, you, Chief Minister, to talk to her directly, because obviously there's issues behind the scenes, to go to her and get these tests speeded up and done on the Isle of Man and turned around quicker?
No, Paul, because it wouldn't be recognised. This test is done in the UK for part of their data research. If we did it on the Isle of Man, they would not accept our results. It has to go away to a recognised centre, which we did say only the other day. Henrietta, would you like to expand on that?
Yes, we have covered this multiple times. We send our tests, and always have done, to the Liverpool laboratory, which is part of the UK Genomic testing network. And that has the advantage that all of it is uniformly quality controlled, it follows the same protocols, it's consistent, and it feeds into the overall data to enable us to understand how we fit in with the bigger picture, and also for the UK to see how the spread is happening.
Okay, so how long before we know the current cases, these 2 cases, how long will it take us to find out what variant they are? From today, how long before you'll be able to report back?
It will take 5 days from their being received in the Liverpool laboratory, but can I say yet again that the nature of the variant involved makes no difference to the communicable disease control actions, which are already underway and will not be altered even when we do have...
It affects how long those people can be in contact. Surely it was 15 minutes. If it's super spreader, if it's the new variant, it's a matter of minutes, isn't it? 2.5 minutes would make it a contactable trace person?
No, we have no evidence to refine the definitions of close or less close contacts at present. Maybe we will have in time, but we don't at the moment. At such time as we do have any data that changes our definitions of contacts, we would apply that across the board in terms of regarding everything as possible new variant, and we would therefore change all our communicable disease and health protection protocols.
So it's still 15 minutes?
No difference to the immediate management.
Is it still 15 minutes then to be in contact with somebody?
Within 2 metres.
And 15 minutes in duration, over 15 minutes in duration?
That is one of the definitions, and it's the easiest one to hold on to. There are actually a whole list that one would work through as a contact tracer. So, for example, if you've been for an hour in a poorly ventilated room with a large number of people, that would put up the risk, which is indeed the sort of definition we applied when we were looking at the pubs and clubs that came up as venues in previous clusters.